First question is to Dr. Boike. Tonight I would think we should discuss some of the advances in imaging technologies. And I think particularly people want to know more about PET scans. And so I think what we should do is let's talk about what PET scans really are, how they were developed, and how they're evolving and being an active part of our acumen in treatment for prostate cancer.
Yeah. First off, thank you, Dr. Lutz. Thank you to the foundation. Thank you to everyone watching. It's my pleasure to be here to discuss this. PET scans are one of those things that they just kept getting better and better. It started initially as functional imaging. So, we were trying to image things like metabolic pathways or different things that make cancer cells, as opposed to normal cells. So in cancer, that might be them having more radioactive sugar use, which is what we use PET scans for in lung cancer. In prostate cancer, it might be, different amino acid pathways like the Acumen scan, like a metabolic pathway. But now the PSMA, which is really a phenotype or looking for a marker on the outside of prostate cancer cells. So PET scans have evolved with biology, looking for differences in cancer cells that we can then detect. And PET scans, as a radiation oncologist, I love physics. So PET scans have really involved with physics in particular. So these radio tracers that we give, they cause an annihilation reaction that emits two photons or two X-rays that go 180 degrees to each other. We detect that with these big cameras or these PET scanners, and then we place those counts back into people so that we can localize it within the person's body. A big advance in PET scans was the combination of a PET scanner with a CT scanner, which really gave us really great anatomic location. So we could see the lymph nodes, we could see the bone, but we could also see where that radioactive tracer, whether it be sugar or PSMA or fluciclovine, a metabolic tracer, we could see where that's locating. So we understand the anatomy as well as the function of what's happening in that area.
So there's a lot of different tracers. And so why are they different tracers? And why do you think that this, the ones that we're using now for prostate, whether it be Acumen or Pylarify, are really true advances?
Yeah, so this is the biologic advance of understanding the disease. And so a lot of what we've been doing with what we call conventional imaging, whether it be a bone scan or a CT scan or even an MRI, is that's just taking pictures of the inside, like looking at it from the outside. But it doesn't tell you what's going on in the cell or what's on the outside of the cell at a metabolic level or a functional level. So these tracers that have come along recently, like fluciclovine, which is Acumen, or PSMA, which is Pylarify, these FDA-approved tracers are really good at pinpointing small areas, which we know are very specific to prostate cancer. And so they've improved the detection and the sensitivity over conventional imaging, CT, bone scan, MRI.
That's great.